Good morning. Welcome to Member Focus Monday. I'm Christina Schaefer, Social Media Manager for HAR. I'm joined this morning by Representative Armando Walle, who is Harris County's COVID recovery czar. Welcome.
Good morning. Good morning. Thanks for the invite.
Thank you so much for joining us. I know you are very busy. We've been following all of the things that you've been doing on social media. So I'm very happy that you were able to take some time out of your schedule for us this morning.
Absolutely. Thanks for the invite. I appreciate, educating your members and answering any questions that any of our friends over at HAR have throughout the morning.
Yes, very good. And if you do have questions, type them in and we will get to them as we go through our interview. Starting with just if you could explain to us, what is the COVID recovery czar? What is that role?
Well, simply put, it's just to help the county judge and the commissioner's court kind of navigate some of these issues. Look, the county, first of all, let me thank Judge Lina Hidalgo for the confidence in me to try to tackle some of these issues. But look, the county judge and commissioner's court were already doing a lot of good work prior to me coming on, or Marvin Oden coming on over at the city. And so he and I have had a good relationship, Marvin and I. But there's no playbook to this, right? Because first and foremost, it's protecting the public health, protecting lives. And to the extent that I have a role in that's strictly a medical expert's role. Right. To the extent that we our joint positions are tied to that, in the sense that we're trying to do relief and recovery at the same time. And so this crisis has demonstrated some of the inequities in healthcare, the inequities in housing, the inequities in some of the policies that we've implemented on a healthcare basis. So one of the things we're trying to do right now is trying to tackle, obviously we're trying to expand more testing sites and expand contact tracing. That's a new term now that everybody seems to know now. That is a medical, those are Harris County Health Department and the City of Houston's Health Department are taking the lead on those. To the extent that we have a role, is really in the relief and the recovery. So right now we're trying to tackle hunger. You see the lines, everybody sees the lines, a lot of these food pantry events. We're trying to kind of get a grasp of where the need is and try to pinpoint where we need to be in delivering food. So trying to find an overall structure to, one, the food issue, food insecurity. The other issue is I think it has a state-related role and a federal-related role is long-term, the digital divide within our communities and our school children. We know that many kids don't have access to laptops, and even if they do have access to laptops, they don't have access to Wi-Fi or internet service. So working with providers, using kind of the bully pulpit of the commissioner's court or the county judge's office, I'm sorry. I don't want to speak for any of the commissioners themselves, but particularly for the county judge, trying to tackle that issue, more of a long-term impact for the future. But right now, we're trying to save lives and livelihoods, and obviously that's kind of the role it's kind of evolved over the last couple of weeks. Sometimes you have a pickaxe, and other days you're a firefighter. Trying to put fires out, right? So yeah. It has a diverse role at this point, but that's the only way I can explain it to folks right now.
Well, thank you, and we appreciate that work that you're doing. Do you know how long you'll be serving in this role?
So we don't have a time frame. Obviously, the legislature, we go back to session in 2021, January, that second Tuesday in 2021. But I think that I serve at the pleasure of the county judge, and so to the extent that she says, "Hey, your job's done, you can move on," I will leave it up to the county judge, and so we don't have a time frame at this point.
Very good. So there's been some question over the last few weeks about the roles of the city, the county, the state. Can you explain to us those roles, and how are the city, the county, and the state all working together? I should say counties, but I know you're representing Harris County.
Right. So let's I don't want to get too into details, but I think this is important for people to understand. Because I get asked the question about why do we have two czars? The reason we have two czars is because the city and the county are two totally separate entities. The city of Houston, a little over 2 million people, home rule city. strong mayoral form of government. And I work with Mayor Turner is a good friend of mine. We served together in the legislature. So this is just a quick civics lesson. Those folks that live in unincorporated Harris County, there's about over 2 million people that live in unincorporated Harris County, and then not including the small cities and towns like Galena Park, Baytown, the villages, Jacinto City, City of South Houston, these smaller towns. In those are incorporated, but unincorporated Harris County, there's about equal amount, right? So for those folks that live in unincorporated Harris County, their government is not the city of Houston, their local government. And so our local government, for all intents and purposes, is Commissioner's Court. And so you have four county commissioners, one county judge. And so the caveat to that is that unlike the city of Houston that has ordinance making ability, the Harris County does not have ordinance making ability. So the county can only do what the legislature, us in the legislature, allow them to do or not do, right? And so that's why you have two roles in this job. And the role that we've had so far with Marvin Odom, we've worked very well together. We're pretty much on the same page on most of the issues that we need to look after testing, expand the testing capacity, expand the contact tracing capacity. But you also have two different entities that are doing that, right? You have the City of Houston's Health Department, and you also have Harris County Health Department, Dr. Shaw at county, Dr. Purse at the city, and Stephen Williams at the city. You know, they work pretty well together, and they're particularly on contact tracing. So both entities right now are seeking to hire up to 300 contact tracers apiece, right? So you expand the capacity to be able to pinpoint where folks are testing positive and attack the virus that way. Because obviously there's no anecdote, there's no cure for it, right? So right now you're using those measures. So to the extent that we're working together, the city and the county are working very well together. The relationship with the county and the state, particularly on the healthcare component, you know, we're working well with them, particularly on contact tracing. So we've had to have conference calls with the state health services department to make sure that, because they're going to ramp up their contact tracing efforts as well. And so the goal would be, you know, if Harris County and Houston are going to do X, Y, Z, let's be able to communicate and plug in data with the state, because the state's going to increase their capacity too. It's just we need to be able to coordinate better so that we're not duplicating efforts. And so to that extent, we are in constant communication with the state officials on that point. And so that's on the healthcare component. You know, I can go into other issues, but I'll stop there just to make sure I answer all your questions. Sure,
absolutely. And I see a lot of members are watching. So if you have any questions for Representative Walle, type them in, and we'll get to those questions. I know this is probably asking you to predict the future, but do you have any idea how long it will take Harris County to recover from this pandemic, just based on the numbers and the things you've seen?
Well, there's no way to predict when this will end or when this will recover. But my just from everything I've read, this is a years long recovery, right? Because when you go to 3-4% unemployment to, you know, you shoot up to 14-15% unemployment, that is catastrophic for many families. And so let alone working people that are trying to get by. Average middle class Americans as well. You know, maybe some of your members are losing income as well. People that, you know, worked hard, that have been providing for their families and haven't really necessarily had to rely on government, now having to, you know, call the Texas Workforce Commission for unemployment, disaster unemployment. So this is a years long recovery, just in my own estimation. But there's really no way to predict how long, you know, what time frame we're looking at. But I suspect, just from my own observations, this would be a years-long, multi-years-long recovery.
Yeah. We do have a question that just came in from Mario. What is the county or city doing to assist the immigrant community?
So right now, what you've had is both the city and the county have passed about $15 million in rental assistance, because the federal government, unfortunately, what they've done is for any families that even legal permanent residents, even somebody that's legal, is preventing them from obtaining any kind of safety net dollars under the CARES Act, or it also implicates other immigration issues because of the public charge, right? So if you're somebody that's a legal permanent resident, and you're trying to adjust your status from an LPR to a citizen, once you meet the qualifications, there is unfortunately a decision that's been brought down that allows for public charge. If you're a public charge, for you to be denied adjustment of status. So those are challenges right now. But I think what you have some philanthropic organizations that are wanting to put resources into relief funds. We're in communication with those folks. But right now, the city and the county, you're trying to make sure that for those folks that regardless of their immigration status, right? Somebody that's here working hard, that has not been a burden to society for all intents and purposes, and they are falling victim to this crisis, that we have some type of safety net for them. And so I think that the city and the county both are trying to reach a balance right now. The city passed a $15 million rental assistance working with Baker Ripley. So those of you that have friends or property owners that have tenants, call Baker Ripley, because they're working with tenants, landlords and tenants, to get rental assistance. The county is going to have, I don't want to say it'll be a very similar, probably a different structure, using the Greater Houston. My understanding is the Greater Houston Community Foundation, I think, is one of the partners that hasn't been confirmed yet, but there will be an entity that will also receive, once Commissioner's Court passes their version, would allow folks to qualify for some type of rental assistance, because we know food, eviction, rental assistance, utility assistance are something that let alone that if you're documented, it's just everybody needs that type of help right now. And so that's what we're trying to do as well, is not exclude somebody that would benefit from that as well.
Very good. Deborah just asked what type of education on prevention for lower income communities that may not have as much access to internet or other resources are you guys doing?
So right now is there's what they call Region 4 is all the kind of the umbrella group for all the ISDs within our region. Is called Region 4. And so the state of Texas, the federal government, they'll have some resources to be able to bridge that digital divide. And that's what I talked about earlier, is expanding the infrastructure so that families, working families, that where children don't have access to internet, don't have access to a laptop or even a Chromebook, if you want. I think those are the new products that are being refurbished and given out to many ISDs. Working with the ISDs to find out a plan. Okay, where we kind of have anecdotally know where the need is, right? But we need to put that on paper. We need to submit a plan to the state and to the feds and say, hey, look, these are the areas that we need assistance. These are the kids. So, for instance, Aldine ISD had a survey that was submitted, I think, to the Greater Houston Partnership in one of the big chambers. Asked ISDs, what is your internet capability? And so Aldine ISD, I know that intimately because that's most of the area that I represent. Up to 40% of those children, those families, don't have access to internet and or don't have access to a laptop, right? So we know the need is dire. We know the need is great, but we're working on trying to connect those kids to either some type of mobile Wi-Fi, but then ultimately make it permanent, right? And also allow ISDs to either, and they've been doing it. You've had some ISDs purchasing Chromebooks for their children, but we know that that's only for one child. That's one Chromebook. You have families like mine. We've been, homeschooling my 9-year-old and our 6-year-old, my wife and I, and so staying home, and we had to dust off an old laptop that I had, 10 years old, so that my 6-year-old could use that one. And look, we're fortunate, we're blessed to have that, to have those. And my son using my new laptop that I work for my law practice, right? And so It's a challenge. It's a very huge challenge, but I think it's something that we can achieve in digital and bridging that digital divide.
That's good. Thank you. Another question here about unincorporated Houston. If you're in an area of unincorporated Houston, where would one go for resources, rental assistance, food, etc.?
So right now, I would go to the Houston Food Bank for food assistance. Houston Food Bank has a very good website, and it pinpoints exactly where, based on where you live, where the nearest church, nonprofit, where they're giving food on a weekly basis. So the Houston Food Bank, to their credit, they're one of the largest food banks in the nation. The logistical component of it, if you haven't been there, you should, if some of your members want to donate or volunteer, because they do need volunteers, is to package all the food, is the Houston Food Bank. Their website has a great map, interactive map. You plug in your information and it populates where you would go to find your nearest food pantry. And we all see that the lines at NRG and some of the schools. There are some nonprofits probably in your neighborhood, or I don't want to say your exact neighborhood, but in your area that could provide some of that assistance. So that's really on the food side. From the unincorporated part, again, it's the same answer. Those of us I live in unincorporated Harris County, out in the Aldine area. So there's actually about 3 or 4 churches within 45 miles of me, because I checked it myself, that are offering assistance, right? Just to make sure. A lot of churches that are doing that. For rental assistance, the county is going to do that. So you can go to the Harris County Social Services Office. There's an office on Jensen Drive that offers limited utility rental assistance. Obviously, they won't be able to help everybody, but you also have a lot of churches like Catholic Charities. United Way is one that will direct you to particular resources that may well help you for if you qualify, obviously, if you meet certain qualifications. I don't want to make a blanket statement, but should you qualify, there is assistance out there. But it's, again, there's so much need out there that, unfortunately, let's just be frank, not everybody's gonna get the assistance they need. That's just unfortunately a reality, but we're trying to reach as many people as we can.
Excellent. To that same point, Bobby asked if she has extra staple foods, where can she donate? I would imagine any of the places, but maybe start locally first, maybe in your community.
Yeah, I would start locally. So for instance, I have 2 Catholic churches, and I think there's a Baptist church right here on Lauder Road. Many of those churches around here and around probably your neighborhood, they'll accept donations, right? Because there's other food pantries that are not necessarily, I don't want to say sanctioned, but they're not part of the food bank system, right? But most are, right? But you'll have small mom and pop pantries in your own neighborhood, at a whatever denomination church. I promise you, there's probably somebody that will take that food, because food is needed for a lot of folks.
Very good. So I wanted to get into a few more questions that I had for you. Mayor Turner's mentioned potential furloughs of city employees. Do you see foresee any issues like that with the county?
So I don't want to speak on behalf of the county on that, but what I do know, obviously as a member, and then again a quick civics lesson, just so folks understand, the city, their revenue comes from sales tax, right? So their primary source of income, sales tax, primary source, and that's why the city's taking a hit right now, because the economy is unfortunately taking a dive this April and May. They're almost entirely reliant on sales tax, right? And so no activity. We had stay safe orders, measures being implemented at the county, and so they're losing revenue. At the county, their funding structures are based on property taxes. So as we speak now, the county is being able to maintain. It's really next year where you'll see a hit. Probably, in my view, you'll probably have a little budget crunch next year at the county level, because the county's resources had already in essence, hit the county coffers when this hit. So they have some revenue to be able to respond. And thankfully so, right? Or we would be in a much tougher position. Right. I don't want to speak I don't want to speak out of term about the county itself. As far as furloughs, I don't want to touch that. But just from a budgetary standpoint, the county is in a slightly better position than the city right now. It's really next year that's going to be an issue.
That makes sense. You've already mentioned some things that realtors can do, but what can realtors do to safely help in their communities?
Well, look, each individual, I would call this a social contract, right? We have to take care of each other. And but for the decision that Judge Lina Hidalgo and the mayor and the healthcare professionals made early on to what we would call flatten the curve. We all hearing that. The county, the Harris County, and we have 2 calls every week with Texas Medical Center, and we talk to Harris Health and a lot of the CEOs over at the Texas Medical Center. The hospital, the best numbers that we have right now are hospitalization numbers from TMC, and right now we've been able to withstand the blow of the virus, right? The issue comes, once you start opening up, we know, I mean, it's just, doesn't take a rocket science. And once you have more exposure, you're going to have more than likely an uptick in positive tests. And so what I would say for your members is to continue to follow what Judge Lina Hidalgo and the medical and Dr. Shaw have been stressing to stay home, wear masks, and keep your distance from people, because that's been our only tool, right? Those have been the tools we've been using prior to the opening up of the state and the county, that using those measures, emergency measures that Judge Lina Hidalgo and the mayor utilized to encourage people, let alone encourage people to make people stay home. So that it's literally for our own safety. And we saw that curve kind of plateau. Yes. And what we don't want to do is in the open that plateau now turns into a spike, right? And so that's kind of the challenge right now, is to encourage members. The virus hasn't left, right? So just because we've opened up doesn't mean that it's freely-nilly, right? That you can just go hang out and go have a beer at a bar and eat, go have a beer at a restaurant at 25% capacity. Just because it's open doesn't mean you necessarily have to go there, right? Just because a barbershop is open, look, I haven't gotten a haircut in 2 months, right? Yeah. That's minimal. That's really nothing. Really, and it takes a lot of patience, right, to be home, to stay home, and to minimize exposure. But that's been our only tool. And look, it's very tough. It's tough economically for people. People are hurting. Bills are piling up. And people don't have a way to pay their bills. Grocery, again, those long food lines demonstrate the need out there. But I would say continue to practice those social distances measures, wearing masks. But also, if you have the ability, if you have the resources, you have time, with certain safety precautions, right? Write a check to the Houston Food Bank, because they really need it. Write a check to your local nonprofit that's doing relief efforts, because this is not just a city and a county issue, right? We're kind of leading the effort, but it's going to take businesses like you guys, local business, small business owners, many of your members. It's going to take the business community, faith-based communities, just individual members to say, look, we're in this together. We're in this social contract together. I'm wearing a mask not to protect me. I'm wearing a mask to protect you, and I hope that you would wear a mask to protect me, right? Because we are, one family in Houston, and we've demonstrated that in the past with many other disasters. Harvey, you name every tropical storm that's come through here, the Tax Day floods, Memorial Day floods. We've done an extraordinary job of coming together as a community, and I know that we can do that with this crisis, come together as a community so that, we become stronger, in the next years to come. That's a great way to look at it. Think of wearing a mask as helping out your neighbor, because, in our area, Houston area, we've always
helped our neighbor when needed, as you mentioned. HAR, we've actually been encouraging our members to conduct virtual open houses and virtual showings and things like that. Wonderful. So to stop the spread and help flatten the curve. So thank you for that. A few questions came in from our members. Courtney asked, is there a way to report the daily number of new hospital ICU admissions for coronavirus?
I guess the ability to see them. Mm-hmm. Yeah, I mean, so if you go to readyharris.org or the Texas Medical Center, they have a website. But if you're on social media, mm-hmm. one of the folks that, because they report, the city and the county have to report those numbers, mm-hmm. right, when they get positive tests. And so I would go to the readyharris.org website, but also the city of Houston, they do a daily count, right? So if you follow Judge Lina Hidalgo on social media, mm-hmm. or Mary Turner on social media, or Harris County, the health department, or the city of Houston health department, they both, Dr. Shaw, Dr. Person, all those guys, those numbers are reported daily. And so, and again, there's a distinction, right? The city will report city-only numbers, and then the judge, Hidalgo, will report Harris County numbers. And there's a little saying in there, it's non-city of Houston numbers. So those of us that live in unincorporated part or live not in the city of Houston, obviously, those numbers get reported on a daily basis. So there's a dashboard.
Okay.
But Texas Medical Center, Bill McKeon is on social media. You can probably Google him, mm-hmm. At the Texas Medical Center website. But they all have their dashboards that they report on a daily basis. And we see those numbers daily as well. Weekly, we have a call twice a week with those guys. And so with, all these CEOs of our healthcare institutions, right? Because our only way the most valuable data that we have are the hospitalization numbers. At this point, hospitalizations are kind of plateaued a bit right now. We're going to find out, in the next week, this coming week,
right,
if we have an uptick because of the opening
of things,
of things, and the best numbers we have are the hospitalization numbers.
Okay. Deborah asked, is there a restriction on the number of people gathering in one public place? Is that no longer in place? I don't hear about it anymore.
Well, so this is again the only way I can answer that is right now you had the county order at the beginning of all this, mm-hmm. Back in March, basically the stay home, work safe measures, right? Mm-hmm. Limited the gatherings, and then we, fast forward, 2 weeks ago, we had the governor, for all intents and purposes, opening businesses up,
right?
And then limited those measures to like 25% for certain restaurants, right? Mm-hmm. Grab and go for retail, mm-hmm. right? Or, and so one of the challenges we have sometimes is enforcing those measures when the state comes in and says, hey, now you can open up. Well, we have to work within the parameters of the state, of Governor Abbott's measures, and we have to fine tune. You've had to amend the stay home, work safe measures to comply with the state standards, right? So right now you do have these measures, they just they're limited in the scope because the state, what they do is they preempt what the local communities can do. That's mm-hmm. the only way I can answer that. But I would say yes, I would limit the amount of people. I mean, if I would just again use common sense. Just because you can go get a haircut, go get your nails done. I know it's frustrating.
Yeah.
It's very difficult. I know it's difficult for folks, but as best as you can stay home, right? Mm-hmm. Limit your exposure. So, for instance, my grandfather's 90 years old. He lives with my mom. I haven't seen my mom. I've seen her from basically within 10 feet. Mm-hmm. I run by and go check on my mom and my grandpa, but I wait, right?
Right.
Try to limit my exposure to them because, just because, again, you got to use common sense, right? this asymptomatic people can be vectors, right? They can be carriers of the virus without you even knowing, right? I think we've heard that ad nauseum on all the 24-hour networks, right? And locally, you can carry the virus without you knowing it, asymptomatic. So why would we want to risk exposing, a loved one or somebody else's loved one because we wanted to go hang out, right?
Right.
Because we wanted to go get a haircut. And I would just recommend people just use common sense, and we can get through this. Just going to take some tough measures to self-discipline as well, to comply with some of those measures.
That makes sense. Thank you. All right. So a few other questions coming in. I did have one more question for you. Just as a Texas legislator, do you foresee any new issues that need to be addressed in the 2021 legislative session?
So, they're always, when you have, so the way I'll answer that is after Harvey, we had, we met as the legislature met the following session, which was this past session. And we had a kind of a committee of, those regions that were impacted, from the Victoria area, Rockport, all the way through Houston, all the way through to Port Arthur, Beaumont area. And so all those legislators along that area, it was bipartisan, took up bill packages, took up bills to respond either, trying to get, so for instance, I carried bills for the Houston Food Bank to try to expand services for the Houston Food Bank when local food banks are replenished, right? We're trying to put resources into local food banks. Expand emergency operations for the state, right? Being able to ease regulations, certain regulations, so that the state can respond to disasters, right? There was about 50. There was probably over 50 bills that were filed in response to Harvey. About 44 of those bills actually passed and became law. I think I carried like 3 or 4 of those bills. I suspect there will be some similar effort the next legislative session. I think it's premature to try to pinpoint what particular type of bill we would file, but I suspect we'll have some legislation coming next session that hopefully, in my view, that would benefit the state.
Absolutely.
Local communities.
Yeah, very good. Nora asked a question. She said, I'd like to understand how cities with lower populations or similar to Houston, who went on lockdown before us and are still on a strict lockdown, have much higher cases.
That would be, look, I'm not, that'd be a question probably like a Dr. Shaw, Dr. First, but particularly Dr. Shaw with the Harris County Health Department would better answer. That's the only way I could answer that question. That wouldn't be my. I'd be speculating. I don't want to do that to any of the members.
Yeah, Sabrina asked if there's anywhere that they can get statistics on children without computers or internet access in Aldine School District, and also do you have similar stats for HISD?
So the HISD numbers, I think were almost similar because I think it was a GHP survey. They surveyed a lot of their ISDs, and that's kind of where I'm getting those numbers from. But I would suspect HISD has very, very similar numbers. I have portions of my district comprise HISD as well. So Patrick Henry Middle School, Burbank Middle School, Sam Houston is just outside my district, but it's really close. And so, but your local ISDs, if you're willing to donate. So I've had individuals, right? I've had individual friends that have reached out and said, hey, luckily they're still doing okay, and they have, resources. They said, hey, we want to help some kids on an individual basis. I want to buy, a couple of kids some Chromebooks, and, you can do that, on your own, to be honest with you, or you can call your school district. I sit on the Aldine Education Foundation board. It's a nonprofit. We work well with our school district, and what we've done in the past is and other entities have bought Chromebooks for kids, and you know, you reach out to your local, you know, neighborhood school. It's very simple.
Okay.
Sometimes we just call the principal and said, "Hey, do you have?" I promise you, they will know.
Yeah.
Who, they're the ears, eyes and ears on the ground, particularly when you want to give back that way. Just call that principal, call the ISD. Usually you can leave a message. Most of the time they're forwarding phones, because obviously ISDs are still technically open. You're just homeschooling, right? I would call them, because they will know, hey, you know, I have a kid, and they'll connect you with, you know, somebody, because we've already done that the last couple of weeks.
That's great.
With some kids that needed Chromebooks, and we were able to provide them some Chromebooks.
That's great. Bobby was saying that she's been reaching out to a few people trying to donate money for rent or utilities or computers. So maybe you've given her a few more ideas there.
Yeah, and you can reach me on my email. I think I gave the email up. It's if you want to post, you know,
they can see it right now. Yeah.
Yeah, you can use that. We can work through those channels to make that connection.
That's wonderful. Yeah. Is there anything else you wanted to share with our members? I know we're a little bit over time, so thank you for being patient with us here.
No, it's fine. No, and I'm sorry, apologize for the long answers as well, but I think
it's all great information
for members to understand kind of the dynamics. But the city and the county, we're working well together, and so I just want to say thank you to your members. And should y'all need any information, I think they'll give you. You'll give Ian my email address.
Yes.
And reach out. I just want to say thank you for the opportunity to address the membership, and God bless you. And we're going to get through this together.
Thank you so much. But before you guys tune out, we do have a quick video about how you could be featured on Member Focus Monday. So let's watch that really quick.
Hi everyone, I hope you enjoyed today's Member Focus Monday. HIR is staying on top of the latest for our members and reaching so many viewers. If you would like to be featured on any one of our channels, like Member Focus Monday or the new Houston Realtor digital magazine that is being delivered to your email at the beginning of every month, please reach out to me. But most importantly, myself and the staff at HIR hope that you and your families are staying safe and healthy. Have a great week, everybody. Thank you, Christina.
All right, so thank you again. A lot of our members are thanking you in the comments, thanking you for your leadership and giving us all this great information. So again, I thank you as well for joining us this morning. Thank you. Appreciate that. Have a good morning. Absolutely. So we will be back next Monday at 9 a.m. for another Member Focus Monday. Have a great week, everyone. Bye-bye. Right. Thanks.